Hey everyone, my name is Andrew. I'm a student physical therapist here at the University of Toronto, and today I want to take some time to talk to you about simultaneous double knee replacements and whether or not this procedure is right for you. Something that you have to consider before going in to decide on this procedure is the idea of pain. And you might think that having two knees done at one time is going to cause you double the amount of pain. But a study has shown that having one knee done or two knees done at the same time is going to cause you relatively the same amount of pain. So that means there's no difference in pain intensity in either procedure. So take this into consideration along with your own level of pain tolerance to discuss with your doctor whether or not this procedure is right for you. If you'd like to learn more about simultaneous double knee replacements, go to the Curovate website and check out the blog that I wrote on simultaneous double knee replacements and the factors that should play into the role in whether you decide on having this procedure or not. Or, if you've had a simultaneous double knee replacement or single knee replacement, check out the Curovate app to get guided physical therapy plans made just for you. Thanks so much, everybody.